oral transport stage, swallowing moves into what's called the pharyngeal stages. The pharyngeal stages is created of many muscles in the throat to help move food through the throat. After the food is prepared and moved out of the oral phase, it is now going to move into the pharyngeal stages of swallowing. The pharyngeal stage are the muscles of the throat, or the pharynx. The pharyngeal stage includes important muscles that help to push food and liquid down through the throat and into the esophagus. All at the same time, the airway is being protected in an ideal situation. As a speech pathologist, we work with swallowing disorders in the pharynx, the pharyngeal regions. Now, let's think in our patients who have had head and neck cancer radiation to the throat and perhaps to the bilateral neck, both sides of the neck, what muscles could potentially be impacted? The first set of muscles that we are going to focus on are the suprahyoids. The suprahyoids are muscles that help us to pull the larynx closed, up and forward. We can sort of think of it as an up and punch. The larynx closes, and the laryngeal vestibule, where the anatomy of the larynx that helps to protect the airway, remains closed during the duration of our patient's swallow. Suprahyoid muscles are typically right here above our hyoid bone, and the suprahyoid muscles are paired muscle groups. We have them on the left and the right. Depending on our patient and the swallowing studies that we complete, suprahyoid muscles may be a challenge or impacted. We treat those. We treat those through exercises. We treat those through strategies. Next, the pharyngeal constrictors. The pharyngeal constrictors are divided into the superior, the middle, and the inferior pharyngeal constrictor. The pharyngeal constrictors help to push food down through the pharynx or the throat into the esophagus. It is a chute. It's like one tube, but the challenge is we share that tube with our airway. So our goal is to keep you swallowing, to keep you as safe as possible, while implementing strategies knowing that the body has changed in the head and neck cancer patient. The pharyngeal stages of swallowing are the stages in which skeletal muscles can be strengthened. There are many type 2B fast twitch muscle fibers that we can work with to try to bulk up and improve the mass of those muscles at the peripheral level. If we strengthen the muscles or improve the muscle mass, the swallow may become more efficient. That is our ultimate goal, to improve our patient's efficiency of swallowing while improving the safety of their swallowing. So, work with us as we continue to explore the stages of swallowing. Swallowing disorders happen in many different diagnoses and populations. Each of those have some methodology and evidence behind how we can help our patients.